Thank you for watching my video. I am not a dentist. I am speaking solely on my research and based on my experience. I've been asked, what do you do once you have 4 bicuspids removed for orthodontic treatment? First of all, I would like to say, do not panic. You have options. Okay, what issues can bicuspid removal for orthodontics cause? It can cause no room for your tongue. Your tongue is supposed to be resting on the roof of your mouth like this. Before my treatment, my tongue was always on the lower portion of my mouth like this. Okay, proper tongue positioning is very important. Okay, another issue that it can cause is sleep apnea, snoring, restriction of your airway, and there are probably other issues, but those are the ones that I have researched. Oh, also TMJ, that is your temporal mandible joint. It can cause it to click or pop. Okay, also it can cause improper lip support since everything is retracted. The reason everything is retracted is because when your 4 bicuspids removed, there's spaces left, and it is easier to retract because your anterior teeth only have one root, so it's easier to have them pushed back than bring your molars forward because they have more than one root. Okay, so now let me talk about what can be done. First, I would start with the least invasive. I would ask your dentist or orthodontist to send you to a myofunctional therapist. What a myofunctional therapist does is it teaches correct tongue posture. Like I said, it's keeping your tongue on the roof of your mouth, which is extremely important. Then if that does not work, I would talk to a board-certified orthodontist, and I would ask him to put braces back if possible and try to bring everything forward. Since when you're retracted, you're retracted probably about 7 millimeters or more back, because that's usually the size of a bicuspid, 7 millimeters. So it's a lot of retraction. So I would ask them if they can bring everything forward, and maybe with the braces themselves cause a little bit of expansion. If not, then another option is to have an adult palatal expander, and you have to find a doctor that does adult palatal expanders. And then sometimes that's enough. You have your palate expanded and then braces, and again everything brought forward. Then if that does not work, then another option is to have the spaces reopened, again with a palatal expander, and then have the bicuspids put back, either with bridges or with implants. That's the most invasive treatment that I've researched. Okay, I would also like to recommend some videos. The videos that I would like to recommend are Dr. John Mew and Mike Mew, father and son. They like to speak about proper tongue posture, stretching, and things that would help with proper tongue placement. Okay, then there's also Ron with Jaw Hawks. He talks about a bad experience he had with the AGA appliance. The AGA appliance is an appliance that is to bring everything forward, but I had it done. I felt that it was very aggressive and it put a lot of pressure on my teeth. I suggested people listen to their bodies. I could not handle it. My orthodontist removed it and then put another type of appliance, an adult palatal expander, and that one seemed to be not as aggressive, and I wore it for about 4 to 6 months, and then after that I had Invisaligns put on my teeth. Invisaligns did not work for me. They were terrible. They just were not for me. They left me with an open bite. It was horrible. And it was a posterior open bite, and because they have some millimeters between them, I was never able to correct that open bite. After 3 refinements, it did not work. So then now I did, I'm on ceramic braces. Hopefully this corrects posterior open bite, and I'm back to biting and being able to chew my food properly again. Again, if you would like me to make another video on this, or you have any questions, please let me know. I would gladly answer your questions, and if you've been through this similar experience, I would love to hear from you. Oh, and also one more video that I would like to recommend is face yoga, and I like to look at Coco. She spells her name Koko. She talks about tongue posture on one of her videos, and about face yoga. That also helps improve if you have a sunken face or if you have problems. She even talks about tongue posture as well. Okay, good luck with your treatment, and I hope that you find this video helpful, and if you do, please subscribe and leave me comments, and I would appreciate a thumbs up. Thank you.